Hi everyone, and welcome to Perry County's Red Ribbon Week. If you are not familiar, this is the oldest and largest drug prevention campaign in the nation. And to kick things off, we just wanted to share a presentation with you all about understanding the opioid crisis, because it has really become an epidemic in our nation, and we want to get you all some factual information about what's going on. So I'm going to share some things with you. And what we want to do today is I want to tell you a little bit about who Purdue Extension is, if you're not already aware. We are connectors. So we connect university resources and expertise to communities regarding four main areas. That's ag and natural resources, community development, 4-H youth development, and health and human sciences, which is what I do. And we also have campus and county-based staff throughout Indiana. We exist in all 92 counties. So if you need anything in any of those areas, feel free to reach out to us and we can get you hooked up. So what are we going to be talking about today? Our objectives are to define the terms and concepts related to opioids, opioid misuse, and address the stigma. We want to review the opioid crisis in the US and specifically in Indiana. I want you all to walk away being able to name at least 2 actionable steps that you can take in response to the opioid crisis right here in our community. And then we'll also provide you with some resources just locally to learn more about opioid misuse prevention, treatment, and recovery. Okay, so let's jump in. First, we want to define some terms to set the scene for this complex and controversial topic. So you may be really familiar with opioids, or you may not have any idea about them, and either one is fine. So I thought we'd start off by just a general definition. Opioids is a catch-all term for many substances that bind to specific parts in the brain, called opioid receptors. A person can consume opioids from opium, which is found in the poppy plants, which is pictured in the slide, or also from man-made or synthetic versions. But our body also actually produces small amounts naturally to manage pain. And there are several kinds of opioids that act in slightly different ways. The names of these are listed and some of the most commonly recognized opioids, but there are many more. So some that you might be familiar with are oxycodone, hydrocodone, heroin, codeine, morphine, and fentanyl. And let's talk about some reasons why opioids are most often used. They have been used for many purposes throughout human history, and mostly for physical pain management and or emotional pain management. Today, opioids are only prescribed to reduce physical pain. Some examples of some common opioid uses for physical pain management include chronic pain conditions, perhaps after a workplace injury or after certain surgeries. Opioids are not prescribed for emotional pain management, yet many people also claim short-term emotional pain relief from taking them. We know how we feel physically affects our emotions and vice versa. This is referred to as the mind-body connection. And sometimes our emotional distress can show up as physical pain too. Some reasons people may use opioids for emotional pain management include relief from depression or anxiety, or to reduce their distress after a traumatic event. Now, these uses can be unintentional or indirect, but they can also be misuse. Opioids can therefore affect people in multiple ways, and the lines of appropriate opioid use can also become really blurry and add to opioid misuse. So if you've not heard of that term before, opioid misuse, I want to address that. It is an umbrella term used to describe several behaviors along a range of risk from mild to severe. Opioid misuse is defined as taking opioids in a way other than prescribed. Examples of this include taking them without a prescription or taking a different amount than what has been prescribed to you. And opioid misuse can unfortunately lead to dependence, which is feeling unable to stop, or it can also lead to an opioid use disorder, which is actually a diagnosable health condition. Now, unidentified or untreated mental health issues may lead people to misuse substances as a way to cope with their issues. But the truth is that anyone is at risk for becoming dependent on opioids, even when they are being taken as prescribed. However, I do want to say that not all opioid misuse starts with someone being prescribed opioids, and not all people who take prescribed opioids are going to become dependent upon these. We share this information not to create fear about opioids or for you to assume that all opioids are bad. There are justified medical reasons to take opioids, and people do the best that they can with the tools around them. But we want you to know that there are also risks. Opioid misuse has become a crisis because of the risk of becoming dependent and the risk to overdose from use, which we see happening at really alarming rates. And there's been multiple opioid crises throughout medical history, as opioids have been used for medicine and pain relief for centuries. But for today's discussion, I want to focus on the events in the last 20 to 30 years that really contributed to the current United States opioid crisis. So we're going to walk through a little history lesson, and this slide shows a quick timeline summary. So in the 1990s, the healthcare community determined that pain was undertreated. And in 2001, they established standards that pain should be required as a fifth area to assess as part of routine healthcare. And so by asking patients about pain more routinely, combined with claims that patients could not become dependent on opioids, healthcare providers were strongly encouraged to prescribe opioids when patients reported pain. And at that point, many people built up a tolerance, which is needing to take more and more and more to feel the effects of the medication and to the opioids that they started with, and then they became dependent. So by around 2010, overdose rates increased significantly. And in response, the healthcare community put restrictions on opioid prescription guidelines. So many people who relied on prescriptions could not get them. And they started looking elsewhere to get their opioids. Then a market for easily accessible opioids developed, which led to untested and often unsafe opioids. And this is what caused overdose rates to spike up. And this is what got us where we are today. So as previously mentioned, the opioid crisis is such a big issue because of the risks to become dependent or to overdose. And now that we know some about how the current opioid crisis came to be, let's talk about who this crisis affects. This is not just a rural or just a city problem, or just a men's problem or a woman's problem, a haves or have-nots problem, a young or old people's problem. This really affects anyone and everyone. Anyone is really at risk for becoming dependent. And I want to pose a question to you all because the answer was surprising to me. How many opioid overdoses do you think happen in the US every day? Let's look at a national opioid crisis snapshot. Opioids are the most commonly misused prescription medications that lead to emergency room visits and overdose deaths. In 2018, there were 6,740 prescription ED visits daily. That is over 2 million a year. And 130 prescription overdose deaths happened every single day. That is about 45,000 a year in the US. This is a very high amount. And another statistic that really surprised me is that almost 70% of the more than 67,000 drug overdose deaths in 2018 in the US involved an opioid. So although not all of these deaths were from opioid or even from prescribed opioids, 70% from one substance type is very, very high. So that kind of gives you an idea of really the crisis that we're in and what we're dealing with. Now, there are several factors that can contribute to opioid misuse and developing an opioid use disorder. In addition to the pain issues that we already talked about, adverse childhood experiences, otherwise known as ACEs, financial difficulties and limited opportunities for prosperity, chronic pain, and social disconnect are all factors in this. And if you're not familiar with ACEs, that refers to potentially traumatic events that occur in childhood. And these experiences undermine a child's sense of safety, stability, and bonding, and then can cause future problems. So definitely all of those things play into opioid misuse. So now that we know the nationwide snapshot, let's look at Indiana's numbers. In the past little bit, we've had 1,174 emergency department visits for any opioid. That was from 2018. Deaths from opioids in 2018 in Indiana are 1,098. And deaths from any opioid in 2019 are 1,211. So you can kind of see that Indiana is above the national average for all opioid related overdose deaths. And there actually is a range even within different areas of the state based often on demographics and variation in substance ability, but the overall numbers still went up from 2018 to 2019. And so this is certainly something that we want to address and that we need to address. So now that we've set the scene for the opioid crisis, let's talk about what can be done about it and what the response can look like. The response to the crisis can really be broken down into two different parts. The first part is changing our attitudes and reducing the stigma. And the second part is introducing and expanding support options for prevention, treatment, and recovery. So let's jump in and talk about that. The way that we talk about things often shows our attitudes or how we feel about them. And the way that people have talked about opioid misuse, opioid use disorders, and really all substance use disorders has been very negative. This stigma affects whether people get help and whether communities welcome resources and services to address substance misuse. And so how do we define stigma? It's really when people are negatively labeled, stereotyped, and devalued in society. And this often will lead to discrimination. And really fewer than half of all individuals living with a diagnosable mental health condition or substance use disorder are actually seeking treatment. So that's really discouraging and speaks to the fact that we really need to change this. And when it comes to opioids, less than 10% of people who need opioid use disorder treatment receive it. Stigma is especially a barrier among rural communities like ours, amongst individuals of color, youth, men, military professionals, LGBTQ individuals, and health professionals. And response support systems and services really struggle to take hold if there are fears about how these services will influence the community, if there are negative attitudes about the people who use these services, or if people disagree about whether or not these services are appropriate. So what can we do? Well, I think it starts with turning from judgment to compassion. Mental health and substance use disorders are valid health conditions. They're not personal failings. The words we use to talk about substances and substance use makes a difference in how we view people struggling with substances. By thinking of and talking about substance issues in an us versus them type terms, we ignore that this is a community-wide, statewide, and nationwide issue, and that we are all affected by the opioid crisis. And it really boils down to the fact that reducing stigma starts with you and with me. For example, a person who has cancer isn't really judged by their disease. When a person's receiving treatment for that, friends and family will show them support by offering to take them to the doctors, bringing them meals, and offering to help in any way that they can. If a person's dealing with substance use disorder and depression, what is the response that they often receive? Are these people treated differently? Do you talk openly to them about how you can help? Substance use disorder is a disease, just like cancer. And individuals who are seeking recovery treatment need our support as much as your neighbor who is battling cancer or some other illness. And so I want to talk about using person-first language today. And that means that we recognize them as individuals first, not by their condition or behavior. This shows value in that person and that we really just value them as a human. Discuss the condition as something the person has, not as a type of person that they are. For example, you would want to say John experiences depression, not that John is a depressed person. And I think this chart is a great way to address that person-first language. There are many statements that convey judgment or negative association related to substance misuse, but this has some great examples of stigmatizing phrases and some more neutral alternative statements that you could use instead. So I want to take a second to quickly jump in and practice some of these statements from a practical standpoint. And so if somebody says Taylor is a former addict, this is really negative. So what could we say instead? We might rephrase this as Taylor is a person in recovery. Another example would be to say, instead of saying Charlie is a drug abuser, you could say Charlie is a person with a substance use disorder. That's just one example. Another thing that we could try is, instead of saying Morgan had a dirty drug screen, you could say Morgan's substance screen came back positive. And there are obviously a variety of ways that we could modify this statement. But I really want you all to start thinking about what are some language cues that you can listen for and changes that you can make to reduce this stigma. How can you talk about this differently with people you know? So as mentioned, part one of the opioid crisis response is talking about changing this stigma. And part two is to introduce and expand support options. And this can be approached from three different angles that I'm going to talk about: prevention, treatment, and recovery. So what do we mean by prevention? This is essentially having education about the risks, knowing the tools available to reduce the chances that someone will develop opioid use disorder, and to prevent opioid overdose. It's much easier to prevent a hole in a boat than it is to treat it when it's already been leaking and sinking. So behaviors and risk factors we talked about earlier, such as those ACEs and injuries, are also a factor in prevention. And then I briefly want to mention harm reduction as well. This refers to a spectrum of strategies and ideas that are aimed at reducing the negative consequences associated with drug use. And some examples that prevent overdose deaths and spread of disease include administering naloxone in an emergency to prevent an overdose death, and needle exchange programs. And there are some other examples of harm reduction in various communities, and I'll provide you guys with some local resources here in a moment. So next, I want to look at treatment. Many levels of treatment exist to help keep people safe and alive, and no one right form of treatment works best for everyone. Some examples include short-term rehabilitation treatment. There's group peer-led meetings, similar to Alcoholics Anonymous. There's medication-assisted treatment, and many, many more options. And as stated, really the best treatments provide a combination to meet an individual's specific needs. And that's going to vary from person to person. So if somebody is struggling with this, we really just need to try multiple options and see what works best. Now, many people assume that once a person goes through treatment, everything is done and there's no more concern. Yet, just like when a person has surgery, and stays in the hospital briefly, followed by an extended recovery outside of the hospital. Substance recovery is more than just substance abstinence. It's an ongoing process long after treatment ends. And I think that's really important to note. Recovery is a process. It's a process of change through which people improve their health and wellness, begin living self-directed lives, and strive to reach their full potential. And there's really 4 major dimensions that support recovery. Health, which is overcoming or managing one's disease or symptoms and making informed, healthy choices. Home, which is having a stable and safe place to live. Purpose, which is conducting meaningful daily activities and having the independence, income, and resources to participate fully in society. And then community, which is having relationships and social networks that provide support, friendship, love, and hope. So you might be thinking, that's great. What can I do about all of this? Well, let's talk about some actionable steps that you can take. Number 1 is go to trusted sources for education and information about what happens in our community. Number 2, work on changing the stigmatizing language. Changing your language takes practice, so really start to be mindful of that. Next thing you can do is really monitor your prescriptions and keep them secure so you're not putting yourself or others at risk. And then the other thing that you can do is just to support some of those general harm reduction measures that are offered by our community and have conversations in our family to talk openly about stress, pain, and stigma. And I think that really goes a long way. It really starts at home, and it starts with you and me. So if you want to learn more, here are a few suggestions for where to start. When used correctly, opioids are useful and necessary. Opioids themselves are not the problem, but the misuse or abuse of them is. We do not want to make people feel bad for seeking pain relief, and we know that not all prescribed opioid situations are the same. So I really want to drive home that if you have concerns about your prescribed opioids, talk to your healthcare provider. Do not be afraid to ask questions and seek out additional information if you are concerned. I want to provide some local resources today as well. We have several local resources, including our Systems of Care directory, which lists all of Perry County resources related to substance abuse. And this can be found at Look Up Indiana. It's a very comprehensive website. The Perry County Health Department is another great source of information, along with our Strong Families, Strong Communities group, and you can see contact information for each one of these places on the screen. Additionally, local coordinating councils can be found through the Indiana Criminal Justice Institute, and these are all great places to start if you're seeking out resources. And just to wrap things up, the main points that I want to drive home from today's presentation are here on the screen. The opioid crisis is ongoing, and Indiana is above the national average. So our state is struggling with this. What can we do about it? We really need to reduce the stigma about substance misuse and seeking treatment so people will feel able to do that. And prevention happens through education. So educate yourselves, educate others. This is a great first step in listening to this presentation and checking out our Red Ribbon Week activities that we have going on all week. And I also want to remind you all that treatment is not a one-size-fits-all. So if one thing doesn't work, there are other options available. Don't give up. Recovery is a process of change. Just deciding that you want to snap out of it is not good enough. It is going to take time. It is going to be a process. So just be patient in that with either yourself or loved ones or your community or others that are struggling. It takes time. And finally, anyone is at risk and everyone is affected. Anyone can also help, including you. So take some of the information that you learned here today and put it into practice. I want to give you guys a shout out and say thank you for attending today. Thank you for watching. And if you've made it this far, please complete the optional survey that I will place the link in the description for this video. And I just want you all to know that your feedback is super important to us and the way that we present programs. So would appreciate you taking a brief moment to fill that out. And then if anybody has questions, you can reach out to me and reach me at mjaspers@purdue.edu, and I'll be happy to follow up with you. Thanks so much, and be sure to continue checking back in for our other Red Ribbon Week activities.